What is Crohn's disease and what can you do about it? Okay, so Crohn's disease is thought to be an autoimmune disorder. And I say thought because I'm not completely believing, for sure it's an inflammatory disorder, but I'm not completely agreeing that it is an autoimmune disorder that is part of your GI system. And one of the frequent causes a lot of mucus and blood. It's usually triggered by different foods. I see a lot of food sensitivities and food problems with Crohn's disease. And then there's some really neat things that you can do about it. Now, the traditional medical approach is to do something to decrease the inflammation and usually some type of immunomodulator. Methotrexate is a common one. Another commonly prescribed medication is Asacol. Um, Sometimes they'll use again, I said methotrexate. Cosinex is one that I've seen. Imuran is another. But what that does, and what they noticed is when they were giving people these different medications for different types of cancer therapy, they saw a lot of these autoimmune conditions temporarily decrease. And so they've kind of repackaged this. And the tough part is about those medications, in my experience, they'll find a medication. Usually it'll work for a time period, usually a couple years, and then it'll stop working. And then they'll get another one that works a little bit less. And I see a lot of people at the end of Crohn's disease looking for alternatives to medicine because they've been through kind of the medical treatment. Almost all of my patients have stomach problems, and ulcerative colitis, which is a little bit different, and Crohn's disease are basically the common denominator is the same. So Crohn's disease, let's kind of go through. The first thing is we want to reduce inflammation in the body. And we can do that by avoiding some trigger foods, and primarily it's grains. Now, I have nothing against grains. And if you could eat grains 100 years ago before they mixed, different types of wheat with goat grass and formed all the super glue, all known as gluten, I think that we had less stomach problems. One of the things I tell people is like the first thing you do, listen, we can spend a lot of money testing on things and doing, put cameras in the stomach and do scopes and scans and everything else. But what I would suggest before you can save a lot of money and it really improves your health. It has almost never failed me is I want to avoid wheat for 90 days. Now, if you do that, a couple things happen. One is this is difficult. It's not forever, but I see a lot of benefit from this. And then one of the things you have to remember is it's not like a sugar diet. Like if you tell people avoid sugar for 90 days and you go 45 days and your kid's birthday and then they have birthday cake and you notice that, you fall off the wagon, you decide I'm going to have some birthday cake, within 24 hours or so, the body's going to respond to that. So sugar is going to be out of your system, but not so when you're trying to do a gluten-free diet or a wheat-free diet. It takes about 90 days for the microvilli to recover from the exposure to the gluten. And so you can go 45, 50, 60 days. And then if you have a weak moment and you have some pizza or peanut butter jelly sandwich or chocolate chip cookie, like that clock resets to 90 days. But what happens is I see a lot of inflammation reduction. I also see that when you reduce dairy. So those are my two recommendations. But let's also talk about some other specific therapies that are really a game changer for Crohn's disease. The first one is that to do some vitamin infusion therapy where you're skipping the stomach because the stomach is mad and red and inflamed. And if you skip it and do some vitamin infusion therapy, if you do put it right into the vein, we can literally put in month supplies of vitamins and minerals inside the vein, and you can heal people from the inside out. So that's the IV micronutrient therapy. I also see tremendous value in hyperoxygenating the tissues by doing something called rectal insufflation therapy. This is an advanced oxidative medicine technique where we literally take oxygen and we run it through electric spark. It converts just a tiny amount of this into ozone. We put it into a syringe with a little catheter. You insert it up the rectum into the colon and you push this oxygen ozone combination. And it is really amazing for oxygenating and healing those little pits and crypts and those bleeding things that you get in ulcerative colitis. Excuse me, for Crohn's disease. I keep saying they're different. Crohn's disease. Now, the other thing that's really, really beneficial is there is a sticky herb called ochrapepsin. And okra is the sticky component. It's literally like vacuum cleaning or a lint rolling the lower part of your GI system. And the pepsin helps to digest the mucus so frequently associated with Crohn's disease. So it's a vacuum cleaner mucus breakdown herbal medicine that works on the distal part of the colon. Higher up in the stomach, some really good recommendations there. I like to break down food faster by using apple cider vinegar or a proteolytic enzyme, which is protein amylase and a lipase, which means it breaks down fats, carbs, and proteins. And we want to protect the entire mucous membrane by giving a combination of your fat soluble vitamins, vitamin A, particularly, vitamin D, vitamin E, and vitamin K. So those help to heal and soothe irritated GI tissue. So a combination of vitamin infusion treatments, rectal insufflation, and protecting the upper system with fat soluble vitamins, and also that vacuum cleaner and mucus breakdown in the distal part of the colon with ochrapepsin. I've seen some really good outcomes with Crohn's disease. Usually a treatment takes about 90 days to go over a Crohn's case where you'll see some nice improvement. It's usually at least 4 to 6 blood cycles. So, Carter, I'm going to put you on the spot a little bit. A blood cycle. How long do red blood cells last in the body?
120 days.
Yeah, 90 to 120 days. And so, when I go and start talking about healing things, usually it takes about 90 days, 120 days for the blood to come out of the bone marrow, go into circulation, carry oxygen, nutrients throughout the body, carry waste products from the tissues to the liver and kidneys, then go to the spleen and literally get recycled. And so about 4 to 6 blood cycles is what I've seen. It takes a lot of autoimmune conditions and Crohn's disease. So it's usually about a year, sometimes a year and a half to see some really nice breakthrough. I love treating Crohn's disease. I see really, really good outcomes with that.